Now in this video we will discuss the differentials of the red eye. Red eye is one of the common presentation and the benign conditions in which the eye will be red but there will be no other associated signs mentioned here. And in alarming red signs you will have decrease of vision, abnormal pupil, lid abnormality, pain, photophobia, discharge, ptosis, proptosis, squint, any lesion on the cornea, limited eye movements, and associated systemic diseases. So this is the first condition. Periocular, you can see mucocele, the patient has got nasolacrimal duct obstruction along with the red eye. So you should know that nasolacrimal duct obstruction can present with red eye. And then the lid abnormalities, entropion and ectropion, they both can cause red eye. So you should know and see the lid whether it is upright or inward outwards. And then the eyelashes, if there is a dandruff like material on the eyelashes, it is called blepharitis, and blepharitis also involve conjunctiva and it can present with the red eye. So you have to treat blepharitis to treat the red eye. Now kids less than 1 month present with purulent discharge, red eye, that is ophthalmia neonatorium, one of the common causes of the red eye in at birth. So you have to treat ophthalmia neonatorium. And one of the most common cause of red eye is trauma to the left eye, vegetative trauma. So that vegetative material has been removed, sutured, eye sutured, but you can see the red eye, traumatic red eye. Now here post-op endophthalmitis, usually after cataract surgery, is one of the dreadful cause of red eye. You will have a decrease of vision, severe pain, mucopurulent discharge, poor glow, hypopyon along with the red eye. So you have to treat endophthalmitis to treat the red eye in such cases. Now this is subconjunctival hemorrhage, one of the common presentation of the red eye, usually due to trauma, hypertension, diabetes, those on the blood thinners, leukemias, forceful exertion, constipation, all can cause subconjunctival hemorrhage. And here the subconjunctival is typical of whooping cough or pertussis due to severe barking cough. The small vessels in the conjunctiva, they rupture and give this look. And now it is a pinkish eye. Pink eye, you can see the fleshy growth coming from the medial canthus encroaching upon the cornea. So pterygium also comes in the differential diagnosis of red eye. So you have to surgically correct it. And this was an interesting case because in the right eye you will see subconjunctival hemorrhage and in the left eye there is a pterygium. So this patient have got red eye in the right eye and pink eye in the left eye. Now here you can see a sectoral red eye. It is a case of episcleritis, and you can differentiate episcleritis from scleritis by putting phenylephrine drops. The eye will become white in episcleritis, whereas this is a case of scleritis in which there will be a pain, associated systemic conditions, scleral bluish hue of the scleral, depigmentation, and with phenylephrine drops the redness will remain and it will not go away. So one of the important differentials of red eye is scleritis. Now here you can see a visible large mass with sentinel vessels. So it is ocular surface squamous neoplasia, which can present as a case of a red eye, and you have to treat it surgically to treat the red eye. And now this patient present with photophobia, severe itching, and these dirty gray looking red eyes. So it's a case of vernal keratoconjunctivitis, one of the common presentations of a red eye. So you have to treat the allergy. Now this case is very important. Nowadays epidemic of adenoviral conjunctivitis is going on in Pakistan, and these patients will have a typical history that they shook hand, or one of the boy in the class got red eyes, and then the whole class got red eyes, even the teachers got red eyes. Or if in a factory workers, first one patient had red eye and then the whole class, and they will have a pre-auricular lymphadenopathy, congested red eyes, and this viral disease will take its course of 7 to 10 days. Now here, now we have come to the corneal causes of the red eye. You can see the metallic foreign body on the cornea. You have to remove the foreign body along with its rust to treat the red eye. And here, contact lens conjunctivitis. Contact lens is also one of the common causes of red eye, because sometimes the contact lenses, they are not washed properly, and they can provide nidus for infection. And here you can see the white patch on the cornea. So these are the keratitis, bacterial and fungal keratitis. They also present with the conjunctivitis and as a differentials of red eye. So whenever you see a corneal involvement, a white patch on the cornea, you should always refer the patients immediately to the eye care professionals so that they treat the keratitis. And this patient had proptosis, red eye, limited movements, and high-grade fever. So it's a case of orbital cellulitis. It's also one of the serious differentials of the red eye, and you have to admit the patient, put on triple therapy, gram-positive, gram-negative anaerobic cover to treat it. And this is angle closure glaucoma patient presented with a red eye, severe pain, headache, nausea, vomiting, decrease of vision. When you check the intraocular pressure, it will be more than 40 or 50. So you have to admit these patients, lower down the pressure with the topical, oral and systemic anti-glaucoma medications, and then the redness will go away, and then you have to do PI and something else. And this is also contact dermatitis, red eye, due to instillation of topical anti-glaucoma drops, because they also touches the periocular skin and causes contact dermatitis. And this patient presented with severe photophobia, constricted pupil, anterior chamber reaction. So it's a case of iritis, anterior uveitis, and you have to give cycloplegics and topical steroids frequently to treat uveitis. You can see KPs and hypopyon in this picture. So uveitis, glaucoma, orbital cellulitis, these are also the serious causes of red eye. And in this you can see corkscrew vessels in the conjunctiva. So it's a case of carotid cavernous fistula. You will have a proptosis, pulsatile proptosis, and it is also a differential of red eye. And the common cause of red eye in a Western world is alcohol abuse. You can have, and the other drugs like cannabis, chars, ganja, where you have a dilated pupils and the red eye. And this is the one of the common causes of red eye, is the congestive phase of thyroid eye disease. So I hope if you remember all these causes, we have covered majority of the causes of differentials of red eye, and you will be able to identify and treat red eye. Thank you.